This is the topic on a page, topic 3, Industrial Revolution, 1750 to 1900 medicine. Causes of illness then. This now changes during this period. We move away from miasma and the theory of the four humors to germ theory in 1861. How did the germ theory explain illness? Germs cause decay. Causes of illness then. Describe Pasteur's two experiments. His 2 flasks of wine, one was open to the air and one was not. The wine that was not exposed to the air had no bacteria and remained perfectly fine. The one exposed to the air, that went off because it was exposed to the bacteria. His second experiment was later, and that was on chicken cholera vaccine, where he gave the chickens a weak dose of chicken cholera, which they subsequently recovered from. This gave them immunity to the stronger strains that came later. Cause of illness then. What existing theories were now disproved? Miasma was disproved, and also the theory of spontaneous generation was disproved. Prevention of illness. Robert Koch was important because he built upon Pasteur's work and identified specific bacteria that cause specific illnesses. For example, anthrax. He went on to discover 21 specific germs that cause specific diseases, and this would be the stepping stone towards vaccines. Which war increased competition between Pasteur and his contemporary Robert Koch? That was the Franco-Prussian War. The French and the Germans were very, very keen rivals, and both governments invested heavily in both these men, and consequently they made discoveries. Prevention of illness. Which country doctor in the 18th century developed the first vaccination? That was Edward Jenner, using cowpox to prevent smallpox. The prevention of illness. Described Jenner's experiment. He knew that milkmaids who caught cowpox were notorious for not catching smallpox. He therefore used cowpox and tested that to see if he could prevent a small boy contracting smallpox, which indeed it did. Why did some people oppose the vaccination? They feared that they would turn into cows. There was also a religious argument that it was against God's design, and doctors would have to train in order to carry out vaccinations, and they were fundamentally conservative and didn't want to change their practice. Why was his discovery a dead end? Firstly, he couldn't explain how it worked, and secondly, there were no subsequent equivalents. There were no other diseases that could be prevented by catching another disease, and many people falsely thought there was and invested a lot of time in trying to find this. Care of the sick. Describe hospital care in the early 19th century. Some of the hospitals were now run by town councils or funded by wealthy individuals making donations. Nurses, however, were of low class and low intelligence. Care of the sick. Which war was Florence Nightingale sent to? Was she volunteered to go to the Crimean War to look after the soldiers that were injured and wounded in the fighting? Her reforms reduced the death rate in her hospital at Scutari from 40% to 2%. And many of her ideas were common sense and not based on any knowledge of the germ theory. She was before then. Clean wards, use of antiseptics, but again she didn't know how they worked, and organising the hospitals and fresh air. Care of the sick. Described the changes. We've just done some of that. Light and airy wards, regularly cleaned, intelligent, trained professional nurses. The 2 books she wrote were the Notes on Nursing and the Notes on Hospitals, both of which became bestsellers and changed the nursing profession globally. The name of the school she established was the Florence Nightingale School of Nursing, but all of her work was based upon a belief in miasma theory, because she was working before the germ theory. But if you look at what she did to the hospitals, you can see that indirectly and unbeknowingly she would have tackled the issue of germs even before she knew of their existence. Treatments. Overcoming pain. Who discovered chloroform was an effective anaesthetic? That was Simpson in 1847. Opposition to the use of anaesthetics was religious because they believed that pain was God-given. There is the death of Hannah Greener, who died of an overdose of chloroform, and also the hostility to anaesthetics because of the period known as the Black Period that came after the discovery of anaesthetics, when surgeons unaware of germs, now with time on their hands, took germs and infection deeper into the body. Pain was overcome, but that of infection was not. The Black Period. Treatments including changes to surgery overcoming infection. This is the work of Joseph Lister from about 1865, and the work that he used using carbolic spray. Treatments including changes to surgery. Why was there opposition to his use of carbolic acid? Cracked hands for the surgeons who didn't believe in germ theory. It also obscured their vision, and it made working with instruments harder because the spray would turn to a liquid on their instruments. The nurses often suffered from cracked hands. How did technology overcome the problems of chloroform? The chloroform inhaler attempted to measure the amount of chloroform going into a patient to make sure they didn't overdose, and the carbolic sprayer, the distributor or the atomizer, was used to make sure that the mist of carbolic was as fine as it could be and not a hindrance to surgeons. Which 19th century disease killed thousands in the 1830s? And that was the disease of cholera. But the government were very slow to deal with the issue of cholera because of their approach to looking after the people, and that was one of laissez-faire. Which doctor proved that cholera was caused by drinking dirty water? That was the work of John Snow, and the work he undertook using the scientific method to map all the infections in Soho in London. How did the government respond in 1848 and 1875? Well, also based upon the work of Edwin Chadwick, the government would bring in the 1848 Public Health Act. This first Public Health Act was advisory, it wasn't compulsory. The 1875 Public Health Act, after germ theory and after more ordinary people were allowed to vote, was far more rigorous and compulsory. In 1861, the discovery of germ theory by Louis Pasteur ended belief in miasma and spontaneous generation, and therefore serious changes with the Renaissance were now underway. The cause of disease now has a scientific, rational explanation, and now we know that germs are the cause. We now have ways in which diseases can be prevented. The development of vaccinations. We also have improvements in public health with the Public Health Acts. Treatments in surgery. We have breakthroughs in anaesthetic and eventually also in infection through the use of carbolic acid and antiseptics. Care of the sick. Hospitals are becoming more familiar, though they are still not funded by the government. And public health and government action is becoming far more comprehensive with the breakdown of laissez-faire.